Good afternoon. Today, again, I bring sobering news with the report of 986 new cases, including 42 additional deaths related to COVID-19. That brings our total in Illinois to 6,980 cases and 141 deaths here in Illinois. Of course, we all understand that these deaths represent people's mothers and fathers and grandmothers and grandfathers and children and co-workers and neighbors and teachers. These are people that are no longer with us, and we extend our heartfelt sympathy to the families that they represent. So many people are working so hard to help protect the health of Illinoisans. We salute our first responders, our military, represented by our Illinois National Guard, our healthcare workers, the truck drivers who make sure that our stores are still stocked, sanitation workers. We're grateful for all of you. But I'd also like to take this opportunity to thank the hardworking staff at the Illinois Department of Public Health. I stand before you each day providing data that our incredible team at IDPH has worked so diligently to collect, to investigate, and to analyze. I'm so proud to be at the helm of the agency at this time and alongside such a talented crew. Public health is like the stealth agency that flies under the radar. Our work is often invisible because of the illnesses and the injuries that we are successful in preventing through our work. But now, the whole world is getting a glimpse of the work that it takes to respond to a pandemic. We are running suspected COVID-19 lab specimens in each of our 3 state labs. We are tracking cases of COVID-19 throughout the state and every one of these devastating losses of life. We are tracking demographic data to keep ourselves honest and ensuring that equity and equal access occurs in testing. On a daily basis, IDPH collects hospital data on the number of beds and how many ventilators. Meanwhile, the nearly 400 babies that are born still every day in Illinois are still being tested at our labs for sickle cell or cystic fibrosis and the 60+ other diseases on the newborn screen panel. We continue to monitor cases of tuberculosis, conduct surveillance for pertussis, Legionnaire's disease, and so many other infectious diseases. We're still processing and issuing birth certificates, death certificates, marriage certificates through our Division of Vital Records. The work that we've always done can't be stopped. So IDPH has been working tirelessly. Team IDPH, I salute you. I'd also like to give a big shout out to all of the local public health departments who work hand in hand with us. They are our essential partners in our fight against this virus. The coming weeks are going to get more and more difficult as the number of cases and deaths continue to rise. But I'm not urging people to despair. Let's be strong and courageous. Don't be terrified. Don't be discouraged. The courageous actions that we need to take are well within our grasp. And those actions are the ones we've been saying from the outset. Wash your hands. Stay at home. Clean frequently touched surfaces. All of these things seem minimal, but these are the courageous actions that are going to save lives and eventually end this pandemic. We are blessed to be under the tremendous leadership of Governor Pritzker and his talented team, not to mention all the state agencies and community partners and business partners who are all helping Illinoisans weather this unprecedented event. No, there's not a vaccine yet, and there's currently no specific treatment, although trials are underway. But what we do have is science telling us that social distancing works, and it's one of our best strategies to get on the other side of this unprecedented event. It is your behavior, it is my behavior, it's everyone's behavior that will turn this tide. We will see an end to this pandemic, and I thank you for your steadfastness.